Component preparation in the blood bank. So a single blood donation can provide transfusion therapy to multiple different patients, and they can do this in the form of red blood cells or platelets or fresh frozen plasma, cryoprecipitate, and really any other components of blood. So the AABB standards address the preparation, quality indicators, and storage requirements for all component products. For the component preparation, so whole blood, it is separated into components, into red blood cells, platelets, plasma, and cryoprecipitate. Apheresis, though, is a targeted collection where it doesn't collect everything. So it will collect just the platelets or just the plasma or just, like white blood cells, something like that. The equipment and process in blood component manufacture. So equipment is used to manufacture blood components and ensure quality control and store these components. We also have the use of anticoagulants or preservatives, additives if it's present, and satellite bags. And these will dictate the next steps in the process. And then, of course, documentation is required at every step. For equipment, we also will use centrifuges and plasma expressors, scales, tubing sealers, sterile connection devices, plasma freezers, and storage devices. Blood product manufacturing and quality control. So as mentioned earlier, we can do whole blood, we can do just red blood cells, just plasma, derivatives of the plasma, and even concentrates of certain products of the blood. For whole blood, this is collected as a 14 milliliter anticoagulant to 100 milliliter of whole blood. So usually it'll be 450 milliliters of whole blood, and it'll have 63 milliliters of anticoagulant in the bag. For storage, it is stored at 1 to 6 degrees Celsius, and the shelf life will depend on the anticoagulant that is used. For red blood cells, the preparation, it is separated from the whole blood, and that's usually done from centrifugation, just like you would with a regular tube of blood. For storage, it is also stored at 1 to 6 degrees Celsius, and it has a 42-day shelf life with the additive solution. Platelets, so preparation, this is prepared from whole blood once again. Donation by apheresis, though, so this is a lot of times where they will collect the whole blood, spin it out next to you, and then give you back everything but the platelets. That's kind of what apheresis is. For storage, we'll have 20 to 24 degrees Celsius, so that is room temp with constant agitation, which is that constant back and forth that keeps it moving so they don't clump. And they have a very short shelf life of 5 to 7 days. For QC, they will check that the pH is greater than 6.2 and contains at least 3 to the 10 to the 11th platelets. That is incorrect on your slide. For leukoreduced products, we'll have preparation, so the removal of white blood cells from whole blood using special filters, and it will actually remove 99.9% of leukocytes. For storage, it's going to be the same as the red blood cells. And for QC, you can't use an analyzer because it's too low of a count. It wouldn't be able to pick up that there aren't any white blood cells in there. So we would do a manual white blood cell count or use flow cytometry to ensure that that count is low. For plasma, so the storage temp is going to be negative 18 degrees Celsius or colder. Shelf life is up to 1 year when stored at 18 degrees Celsius or below. In usage, so it must be thawed before transfusion, and once thawed, it has to be stored at 1 to 6 degrees Celsius and used within 24 hours. For cryoprecipitate, the storage is negative 18 degrees Celsius or below for up to 1 year. For QC, we'll do a factor 8 in fibrinogen activity assay. So in special processing of blood components, so irradiation, the purpose of irradiation is to prevent transfusion-associated graft-versus-host disease. The mechanism is it actually destroys donor lymphocytes that can cause graft-versus-host disease in immunocompromised recipients. We can also do something called washing. The purpose of this is to remove plasma proteins that can cause allergic reactions and to remove antibodies when necessary. This is commonly used for patients with severe allergic reactions or IgA deficiencies. We can also do aliquots, and this is really a small volume of blood product divided from a larger unit. This is used often for neonatal transfusions or patients requiring small amounts of blood. Pooling of blood products, so this is combining multiple units of the same blood product into one unit for transfusion. So cryoprecipitate is often pooled to achieve the desired volume and factor concentration for patient use. For plasma, it can be pooled for specific transfusion requirements or fractionated processes, and platelets are commonly pooled from multiple donors to create a therapeutic dose for transfusion. Plasma derivatives, these are different from blood components because they are prepared by further manufacture of pooled human source and recovered plasma. There's recombinant DNA technology or monoclonal antibody purification, which may also be utilized in their preparation. So source plasma, this is defined as plasma that's collected by plasmapheresis, and it is intended for further manufacture into plasma derivatives. For recovered plasma, this is plasma recovered from whole blood donations that is shipped frozen to a manufacturer. And then cryoprecipitate is separated from plasma, and then it is used for the production of factor VIII concentrate. The residual plasma is then separated into various proteins by manipulating the pH, alcohol content, and temperature. These products can undergo viral inactivation by any of several methods, including heat, solvent detergent treatment, and nanofiltration. For factor VII, so this is produced by recombinant DNA technology. This is used in patients with hemophilia A who have circulating antibodies or inhibitors to factor VIII. Patients with congenital factor VII deficiency, maybe patients that have had a trauma or massive transfusion in liver transplantation, or patients who have uncontrolled non-surgical hemorrhages after implantation of ventricular assist devices. Factor VIII concentrates, this is used to treat patients with hemophilia A. They have almost completely replaced cryoprecipitate as the product of choice. It may be prepared from large volumes of pooled plasma, and it's more commonly prepared by recombinant DNA technology. Factor IX concentrates, so production this is developed using monoclonal antibody purification techniques to isolate and concentrate factor IX. Forms available as prothrombin complex concentrate, and it contains multiple clotting factors, including factor IX, used for urgent reversal of anticoagulation or factor IX deficiency. Factor IX concentrates, this is specifically purified preparation of factor IX for targeted therapy in patients with hemophilia B. And recombinant factor IX is produced through recombinant DNA technology, providing a safer alternative without risk of bloodborne infections. Immune seroglobulin, this is a concentrate of plasma gamma globulins in an aqueous solution. It is indicated for a lot of different patient conditions, but it's usually for immunodeficiencies. RH immune globulin or RIG, this is a solution of concentrated anti-D. This is prepared from pooled human plasma of patients who have been hyperimmunized and contains predominantly IgG anti-D. This is used for the prevention of RH-related hemolytic disease of the newborn. Dosage and administration recommendations and prevention of the RH and hemolytic disease of the newborn will vary, so make sure you know those. Labeling of components. So components must be labeled in accordance with the AABB standards, FDA regulations, and the International Society of Blood Transfusion. So make sure we have the donor identification number, product donor linking, and labeling requirements for volunteer and autologous components.